Let's talk about why you may have pain, whether it's back pain, neck pain, shoulder, hip, or knee pain, and how do-it-yourself PT can help put an end to it. You may have answered that you have pain because you have arthritis, or a disc bulge, cartilage tear, tendinitis, bursitis, chronic joint pain, all the things my patients tell me when they first come to my clinic. But that's a finding or diagnosis and not why you have pain. Let me explain. But first, you may have answered that you have pain because of a direct trauma. However, in this case, we are told 6 to 8 weeks tissue is healing, and by 12 weeks you should be good to go. But that's not the case for most of us. Pain lingers beyond what they say it should. Let me shed some light on how these diagnoses came to be and what you can do now about your pain. One of the primary reasons we have pain is that we are like a computer running a program that we did not consciously choose. What I mean by this is the body is neurologically hardwired to follow the path of least resistance, which means to save energy. It is also neurologically wired to avoid pain. That's its mandate. These two things together result in all your movement patterns and define how you sit, stand, and walk. Neurologically wired to save energy and avoid pain, each person, based on their flexibility, strength, and previous injuries with scar tissue and adhesions, are living and moving in ways that have a hefty price on the body. This hefty price is joint degeneration, osteoarthritis, wear and tear injuries, and pain. In other words, we move in ways that serve us in the short term, and yet we pay for it in the long run. This is because of a third principle in the body known as Wolff's Law, which states, when bone is stressed abnormally, it grows new bone. In other words, this law of the body is saying that muscle tightness, muscle imbalances, scar tissue, weakness, and misalignment all cause abnormal strains on the bones and joints, and this results in bone spurs, degenerative changes, arthritis, and pain. Okay, I just gave you 3 principles explaining why you have injury and pain, and this is good news. Yes, good news, because we can address all 3 of these causes and reprogram your body out of pain. Do-it-yourself PT provides you with step-by-step exercise programs and education to restore your flexibility and alignment, release adhesions and scar tissue, regain strength, relieve strain, and reprogram how you sit, stand, and walk. Each program is sequenced to begin with easy corrective movements intended to lubricate joints, release neural adhesions, shut off muscle spasms, and reduce pain. Then, we progress gently through a carefully planned program of different stages, culminating in moderate strengthening for those of you who want it. Listen, there is magic in positioning the body precisely to turn off something tight and turn on something weak, because now you invite pain-free movement. In these programs, I teach you why each exercise is important for your healing and exactly how to perform each movement without compensations. There's truth in the old saying, knowledge is power. You do not need to go to the gym. You do not need fancy equipment. You do not need to drive to a clinic. You can begin to relieve pain now in the comfort of your own home. You can either choose the Platinum program and get a library of education and sequenced exercise videos with step-by-step instructions for you to work through on your own time in your own home. Or you can choose the Platinum Plus program and have me personally work with you via video to design you your own individualized program. Either way, I look forward to helping you get out of pain and return to doing the things that matter most to you.